Morning, Dr. Victor. Thank you so much for
Good
being with
morning.
us at Afro-Vegan Society today.
Oh, thank you so much for having me, Jessica. I really appreciate it. All the work that you do in the community. Thanks for having me on.
Thank you so much. Yeah, we were just saying before we started recording that it's been a couple years since we've had the
Yeah,
chance to connect with you, but we're so glad to have
yeah,
you back and to talk about this very interesting and informative topic of the connections between oral health and heart health and plant-based eating.
yeah. Those are some of my favorite topics, and I'm
Great.
sure yours also.
For sure, for sure. But I'm definitely looking forward to learning some new things today as well.
hmm
Okay,
Sure.
so let's start this off. I'm going to read Dr. Victor's bio just so our audience can get a better familiarity with you, and then we're going to hop right into the interview. Dr. Terry Victor graduated from Howard University School of Dentistry in 1998. The following year, he completed a general practice resident at St. Elizabeth Hospital in Washington, D.C. Dr. Victor is also a graduate of the prestigious Foundation for Advanced Continuing Education. He is an accredited member of the International Academy of Oral Medicine and Toxicology and a member of the Academy of General Dentistry. Dr. Victor has had the pleasure of speaking at Howard University, Georgetown, and George Washington Universities. Dr. Victor created one of the first holistic, biological, and eco friendly dental offices on the East Coast. He is aware of the importance of healthy eating and the effects it has on oral hygiene. As a holistic and biological dentist, he is dedicated to the improvement of the overall health of each of his patients, working alongside their medical doctors, providing them with the best patient care possible. The eco friendly dentistry refers to all aspects of the office being built with sustainable material, and on a daily basis, Dr. Victor works to create a safe and healthy environment for his patients, staff, and the planet. So I'm going to start off with our first question, which dives more into the holistic approach that you have to dentistry. So, for our community members who may be unfamiliar with the term, how does the philosophy of holistic and biological dentistry differ from traditional dental care, particularly in how it treats the whole person rather than just isolated teeth and gums?
Sure. Our philosophy is that the body is connected, right? It's like your teeth are not separate from the rest of your body. So when something happens with the body, you have to treat like the whole thing, you know. Sometimes in Western medicine, they like to compartmentalize parts of our bodies and this part and that part. But ultimately, if you're going to do things holistically, you want to be able to treat the whole body. So holistic dentistry is where you are able to use alternative therapies in the dental work that we do. So we use homeopathic remedies, supplementation, aromatherapy. We use all these different modalities in order to augment the dental work that we do and to make it in a way that it brings it up to another level. And then, like I said before, the philosophy also talks about or incorporates those things that will bring the total health of the patient into focus and into a higher level. So, as you mentioned before, we work with different practitioners, we work with different doctors, so that if there's something happening with a patient's health, if I can refer the patient to another practitioner, another holistic practitioner, whether that practitioner is um, acupuncture, whether they do herbal treatments, whether they do chiropractic work, it helps in that patient getting the type of care that that patient needs, so that their whole body is able to benefit. And sometimes that even, if we talk about the whole body, that could even include the mind also. It can include the emotions. It can include all of these different things. So to see the patient, another aspect of holistic dentistry, biological dentistry, is to see in and kind of involved with like the whole aspect of a patient's being. Because when you come to the office, you're so much more than just what's looking in your mouth. You come with like your past, you come with your biases, you come with your experiences. So you try to kind of put all of that things together so that if the patient is having an issue, you're able to kind of like balance it out a little bit more. And I think that we've been successful in doing that. That patients really appreciate that kind of like whole person kind of interaction that we do at the office.
Wonderful. Okay, so moving into our second question, talking more about the heart mouth connection. So,
Mhm.
your practice emphasizes the direct link between oral health and systemic diseases. Can you
Mhm.
explain the biological bridge between gum health and heart health and why a healthy smile is a critical component of cardiovascular wellness?
Yes. Oh, wow. Excellent question. Excellent question. That's one of the things that we really try to impart to our patient, that your mouth is connected to the rest of your body. A lot of times, it might sound like it's simple, but a lot of times people don't recognize that what that's happening in your mouth is a reflection of what it is that's happening in your body, and what's happening in your body can be reflected in what's happening in your mouth. So a prime example of that, as you asked about heart disease, is that bacterial infections in your mouth can get to your bloodstream, and it can go to your heart. It can cause inflammation that's in your heart, and it can cause you a whole bunch of different issues. So that bacteria, for example, in your mouth, if we're talking about dental, what you come to the dentist for, that bacteria that's in your mouth, it causes inflammation. It causes inflammation in your mouth, but the bacteria doesn't stay in the like, doesn't stay in your mouth. As we have said before, the mouth is connected to the rest of the body. So that bacteria that causes inflammation in your mouth, it also goes into the rest of your body, and it can cause inflammation also in the rest of your body. And inflammation is one of those things that they're really doing a lot more research about. Inflammation is like the foundation for a whole host of different disease processes that happens in our body. Most of it happens because of the inflammation, and then once you get inflammation, then you get infection. Then once you get infection, you can get breakdown of the tissues. Once you get breakdown of your tissues, then your body starts to send inflammatory cells there to kind of like try to wall things off. So all of that starts with inflammation, and if the inflammation is coming from your mouth, then it can wreak havoc in the rest of your body. And as far as your heart health, the blood vessels in your mouth is connected to the rest of your body, as I've said, but it can also lead to your heart. So that inflammation goes to your heart, and then it can cause some issues with your heart. But also, what they found is that the bacteria that's in your mouth, that bacteria has been found in people that have heart disease
Mm,
in the vessels in their heart disease. So it's
mm,
the same bacteria. So it kind of gives like a direct correlation between what's happening in your mouth and direct correlation to what's happening in your heart. So that can cause all kinds of heart disease. It can cause stroke. It can cause arteriosclerosis. It can cause heart attacks. All of those things it can cause because of you having the bacteria in your mouth, and it's spreading throughout your body. And the other thing too about it is that bacteria, if you get that bacteria in check in your mouth, it really decreases the amount of inflammation that you have in the rest of your body. Because a
mm,
lot of times the bacteria that's in your mouth, it's very there's a lot of it. There's a lot of it there. If it's especially if that person has like gum disease, has what in dentistry we call periodontal disease. If there's all already started to some breakdown in your tissues in your mouth, it means that there's like a lot of bacteria there,
mm.
and that bacteria, like I said before, can flows to the rest of your body. But if you're able to get that bacteria in check, you come to the dentist, you get that you get that bacteria handled, then it could really decrease the amount of bacteria that goes throughout your system. So one of the things too is that inflammation doesn't stop at your gums, right? It infects and it infects and affects all of the all of your body systems. It affects all of your body systems. So it doesn't just because you have inflammation in your mouth, it doesn't mean that it's not in anywhere else in your body, because it very well could be. And like I said, they found the bacteria that's in your mouth. They found it in they find it in all different um, areas of your body if you're able to dissect that. So it's a very important issue, and it's an issue how the mouth connects to the heart in particular, because in our society we have like heart disease is one of the primary diseases in our society. But I think my thought process is that if we're able to take care of some of the things that happens with the a large source of where that bacteria is, we can significantly decrease the amount of heart disease that is in our population.
It's so interesting to hear you make all those connections because I feel like, especially like in our society, we think of so many things as compartmentalized that are like
Yeah,
very obviously interconnected. Like,
yeah,
obviously, what you eat in your mouth is connected to your heart and everything else in your body. Your mouth is
yeah,
the main way that most things enter your body, like food,
exactly. Yeah.
liquid. So, I mean, of
Hmm.
course, as the gatekeeper, the health of the mouth itself would be a great indication of what else might be going on in your body. So,
Yeah,
it's really great to hear that explanation of it and like kind of have that light bulb moment. Like, oh yeah,
yeah.
this obviously makes sense.
Yeah, 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 yeah. It certainly makes sense, and it makes sense in that we need to, I think, maybe pay a little bit more attention to what it is that's happening in our mouths, because of the it's much better and it's much easier, less expensive to than it is to try to um, get cardiac disease, heart disease, to move in a different direction. You know what I mean? It's much
Mhm.
easier if we just take care of that, because it can be one of the primary causes of heart disease, as opposed to a coronary bypass. You know what I mean? It's
Yeah,
it to me that the two between the two of them, there's no debate about which one might be easier to take care of and less traumatic for the patient.
absolutely.
Yeah.
Absolutely. Okay, so diving a little deeper into that, you focus on proactive dental care to help patients get and stay healthier. So, what are some common oral symptoms that might actually be early warning signs of underlying heart health or other systemic issues in the body?
Okay. Excellent question. I like that one too. You're asking some good ones today. One of the primary symptoms in your mouth that's an indication that there is something seriously wrong is that if your gums bleed.
Mm,
It might sound like pretty simple, but if your gums bleed, there's something significantly wrong.
mm,
So my question then to people is that what would happen if your gums bleed if you floss, or if your gums bleed when you brush, or if your gums bleed when you touch them? Those are indications that something is pretty serious. I would ask people, what would you think if you touch your leg and your leg started to bleed? Or if you put a piece of floss on your leg and your legs started to bleed, you would
yeah,
think, "Oh my God, let me get to the doctor and let me see what is going on here. There must be something serious happening."
yeah,
We should have the same sort of thought process with your gums. If your gums bleed, it's not a normal process. There's something seriously happening there. So whether they bleed, whether you brush, whether they bleed when you floss, whether they bleed when you touch them, that's one of the indications that something is happening that you need to take care of. Because they bleed because they're inflamed. They're inflamed because bacteria is in there. Bacteria is in there because you've allowed the environment in your mouth to be susceptible to bacteria getting
mm,
in. So all of those things are very, very important. And if the bacteria is, as we spoke about earlier, if the bacteria is in your mouth, then you know the bacteria is now systemic, and could attack other systems in the body, as we talked about with cardiac. But to me, that's one of the biggest red flags, is
yeah,
that if your gums bleed. Another one of the big red flags is that if your teeth are mobile, if your teeth move, they're not supposed to do that. They're not supposed to move. If you can move them, then it's an issue. There's an issue that somehow your teeth have kind of like disconnected from the bone that's
mm,
holding them in your mouth. Either there's something happening with the tooth, or there's something happening with the bone. So that is another major indication that there's something that else is going on. And that's also can involve something systemic also, because once again, it might be a matter of bacteria. It might be a matter of that there's something that's happening with the bone health, that causes that. And if and then, as we talked about, the body's connected. The bone that's in your mouth is the same type of bone that's in your rest of your body. So if you have like some kind of like bone issue that's happening and your teeth get loose, it's not just something that's happening in your mouth. It's
Mm,
something that's going to be happening in the rest of your body because you have bone in the rest of your body.
mm,
So we need to take that into consideration. That is another major red flag that you need to to kind of like explore and see what it is that's happening. Another major red flag is that if you have missing teeth, so if you have missing teeth, it means that you've lost teeth already. And if you've lost teeth already, there's a particular reason that you've lost those teeth. And usually those reasons involve something that is systemic. We like to catch things before you get to the point where you lose teeth, but you want to make sure that if there are missing teeth, that those missing teeth are replaced. So between those three things, I would say those are the biggest issues, and then you can see those issues because the patient can see those issues at home. They can see that their gums are bleeding. They can see that their teeth are moving. They can see that they have bone loss. They can see that teeth are missing. They can see all of those things at home. They there needs to be some action taken to take some corrective measures to making sure that those things that you're seeing in the mouth, those things that you might be seeing in the mouth, they might be happening early in the mouth. Maybe they haven't progressed so much to the rest of the body, so you can
mm.
still catch them while they're early. But those things once again needs to be addressed. And if they're addressed in a timely manner, you might be able to get them before it gets full blown in the rest of the body. One of the other things also that we can put on top of this layer of those red flags that I've given is also some other lifestyle things that patients might have. So kind of like smoking, really kind of is like
Mm,
really like a factor that can really influence our mouth and the rest of our body. Certain kind of genetics that
mhm.
if your parents had certain kind of thing, your grandparents have certain kind of things that they're predisposed to, that can also affect. Alcohol intake is another big one. Is if you have like a high alcohol intake, those things also can influence not just your mouth, but they can influence the rest of your body also. So all of those are lifestyle things that you can take care of, and that also needs to be addressed when you come to the office so that we're able to handle some of those things.
It's really interesting to hear you talk about the risk factors because in the plant-based food space, one of the things that we know is that diet can also be a source of
Oh
inflammation.
yeah.
And
Mm-hmm.
so to transition or make the connection between like looking at the early warning signs that you can find in your mouth that are connected to the rest of your body systems, and then connecting that to plant-based eating, it's so
Mm-hmm.
powerful to hear how oral health acts as an early warning system for the
Yeah.
rest of our body. And it really influences the idea that we can't treat just one part of ourselves in
Yeah.
isolation.
Mm-hmm.
And so, speaking of the whole person approach, I want to take a moment to look at the fuel that we're providing our bodies. So, when we talk about heart health and systemic wellness, nutrition is one of our most powerful tools. By choosing a balanced, whole food, plant based diet, we're giving our bodies exactly what they need to thrive. These foods are naturally cholesterol free and they're low in saturated fats, which is essential for keeping our arteries clear and our circulation strong. But it goes beyond just the heart. This way of eating supports digestion, reduces inflammation, and provides the raw materials that our bodies need for every single bodily function. And since we know, thanks to what you've shared with us so far today, that systemic health starts with what we put in our mouths, I also want to share a few plant based superfoods that are particularly great for supporting healthy hearts and smiles. So, leafy greens like kale and collards are packed with nitrates that help our blood vessels relax and improve circulation, while the high calcium and vitamin K content are essential for maintaining bone and tooth density. Crunchy raw vegetables like carrots and celery can act like natural toothbrushes. They stimulate saliva flow, which neutralizes acids, and their fiber helps sweep away cholesterol from our digestive tract. And
Mhm.
berries like blueberries and raspberries are loaded with antioxidants that protect our heart tissue and help reduce the inflammation in our gums that Dr. Victor mentioned. And also, sea vegetables like dulse and kelp are true seafood and are rich in minerals like iodine and magnesium that support our metabolism and overall mineral balance. So, Dr. Victor, building on that, I'd love to get your professional take. From your
Mhm.
perspective as a biological dentist, what are some of your favorite heart healthy foods that also serve as superfoods for maintaining strong enamel and preventing that gum inflammation that we're trying to avoid?
Yeah, sure. I'm glad that you mentioned the foods, because the foods are our biggest way that we can get all of this stuff in, all of this stuff that we've been talking about. The foods, and especially the vegetable foods, are our biggest weapons that we have. I don't like to use weapons, so why do we have to use weapons? Our biggest systems that we have in order for us to get our health back on track. So I really appreciate you. I really appreciate you bringing those out. Most of those ones that you have, you hit a lot of the good ones. One of the ones that I would say, it's not really like a vegetable or food, but onions and garlic. Onions and garlic are, and they both have antibacterial property. So to be able to cook with those and to be able to have those in those things that we eat are also very good for very good for your system. But the as you mentioned, the green leafy vegetables, those are very good. They good for the enamel, and they decrease the gum disease, and they're also good for your heart. Those are those the green leafy vegetables are major ones that we should really always incorporate in almost every meal that we have. I think that we used to do that in the, as they used to say in the old days, that we used to do that. That used to be like that used to be in a stable, especially in our diet in African diasporic diet. It used to be a staple in our diet. So I think that that's pretty good. The broccoli and stuff like bok choy, those are also very good. They strengthen the teeth and they reduce cardiovascular disease also. And as you mentioned, the crunchy vegetables, those could are good to for the things that you mentioned, but they also could take food particles off your teeth because they're like a hard and solid. They can take stuff off your teeth. But definitely definitely for us, the diet, especially if you can keep that diet in that with vegetables and fruits and those sorts of things, it is probably one of the best way that you're able to combat some of the things that we've been talking about with the health of your teeth and those sorts of things. It's an excellent. So I appreciate your society and those things that you all do to try to raise people's awareness about why it is to have like why it's so good to have like a vegetarian or a predominantly plant-based diet, because that in the past that's how we used to eat, where we would most of what we ate would be plant-based, and that particular diet is really important in keeping our mouth health in check, very much so.
Okay, so what we eat is like something we do on a daily basis. So could you share like some tips or like what does a good daily at home oral care routine look like for someone? Obviously, we know what like the big signs are to look for to get intervention from a dentist, but yeah,
Mhm.
what does a good routine on a daily basis look like?
Yeah, that's a good question. I tell my patients that you can come and see me and we can do things, but really what you want to do, you want to do stuff preventatively. You want
Mhm.
to, when you come to see me, you don't want me to be doing a lot of stuff. You want to just, clean your teeth. I take a look, I check, and it's like, oh yeah, we have good conversation, and then you go back home again.
Mhm.
So the onus of taking care of your teeth should really lie upon you at home. because you see yourself every day, right? You see me once every 4 months or once every 6 months. So what you want to do is flossing is so super important, right? Flossing is very important. Flossing is even better than brushing, to
Mhm.
be honest with you. I used to have when I was in dental school, I went to dental school at Howard, and I used to have a professor, and he used to say, you just floss the teeth that you want to keep. So, in saying that, it means that if you want to keep your teeth, then you floss, right? Because
Mhm.
flossing gets in between your teeth, whereas the brushing kind of like just gets on the sides of the teeth, right? And it's in between your teeth is where the bacteria will go, because that's where they can hide. In between your teeth is where the food particles would accumulate and therefore draw the bacteria. And it's in between your teeth is where the cavities would start.
Mhm.
So the flossing is so very much important that I've even heard people say that if you had your choice between flossing and brushing, you could only do one, you would definitely do the flossing, because
Mhm.
the particles that the brushing takes off your teeth, you could even just rinse your mouth out, and that would take off the larger particles. You still want to brush your teeth, but
Mhm.
flossing is the most important. So flossing and then brushing at home, and then it also it's good to have like some kind of natural mouth rinse, a mouth rinse that you can use. We don't recommend mouth rinse with like, a lot of chemicals in it. I don't recommend stuff with anything with like sugar in it. I don't recommend anything with alcohol in it. There are lots of mouth rinses that are out there. We have a mouth rinse that also works really well, and the mouth rinse and the toothpaste should not have any of those things in it. It should not have alcohol. It should not have sugar. It should not have chemicals in it. It shouldn't have anything that you cannot pronounce the name of it and it's this long. It shouldn't
Mhm.
have those things in them, because you don't need those things in order to have good oral health. So you get like a natural mouth rinse, you get a natural toothpaste, and you do that. You brush in the morning. Actually, you're supposed to brush and floss every time you eat, but
Mhm.
a lot of times that kind of like is not it's not just practical for most people. Some people might be able to do it, but um, when you want to brush your teeth, especially, is before you go to bed at night. So if you're going to brush your teeth once, and I don't want you to brush your teeth once, but if you only had the choice to brush your teeth once,
Mhm.
you would brush your teeth before you go, and floss before you go to bed. Because what
Mhm.
happens is that if you keep the food particles on your teeth that you have eaten throughout the course of the day, and you sleep with that food particles on your teeth, it's not very good, because it's a warm, moist, dark environment if you're sleeping, and that bacteria gets to be there for like 8 to 10 hours that you sleep with your mouth closed. So that's like bacteria heaven. So
Mhm.
you want to decrease the food that they would get by brushing and flossing before you go to bed. And of course, you want to brush and floss when you get up again in the morning, because that's really going to help. So those things that patients should do, or people should do, in order to make sure that they have good oral health. And if you're able to follow that, then if you follow that and you follow that consistently, it's really easy. Then you come to the dentist. The dentist or the hygienist doesn't have to do as much work, and then it's less trauma to you. It's a much easier appointment. So that's how I would say that you would want to do your home care. Really, really easy like that.
Okay. As you were talking, another question came to me, and that's does does gut health impact your teeth? Like I've heard people talk about the connections between how certain nutrients are absorbed in your gut, and
Mhm.
so if your gut isn't healthy, it impacts your teeth. Have you seen any correlation between
Yeah,
those things?
sure. There's a correlation between your gut health and your oral health. Now they're finding that with research, they're finding that your gut health is probably one of the most important aspects of your health. I mean, before they were like, oh yeah, your probiotics and that kind of stuff is good, but now they're finding out that it just doesn't. It impacts like almost every aspect of your health, your gut health. It's very important. It definitely impacts your teeth. Another way that it impacts your teeth, or your teeth impacts your gut health is that what they've done some research. They did a large study in China, a large study in France, and what they found was that the more teeth that you have missing, the more you will have gut issues.
Mm.
Because what happens is that if you have teeth missing, then you can't chew your food properly because you don't have enough teeth. If you
Mhm.
can't chew your food properly, you can't break it down properly so that in fine enough pieces so that your gut can extract the nutrients from it. So your stomach can't extract the nutrients from it because it's in too big of pieces because you haven't ground it down in your mouth, because your
Mhm.
mouth is the first line of digestion. So then what ends up happening is that if you don't break it down properly, your body can't draw the nutrients from that food when it's in your stomach. Then you start to have to you start having issues like irritable bowel syndrome, leaky gut syndrome. You start to have all of those gut issues because the issue is that you're not breaking down your food properly. And
Mm.
then once that the bacteria in your gut is good bacteria that you have, the bacteria in your gut sends up sends up good bacteria into your mouth because the two of them are connected, and then you don't get that same amount of good bacteria that's in your mouth. So that's why you should always replace missing teeth that you have. If you already have missing teeth,
Mhm.
replace them. If you don't have missing teeth, do your very best to keep the teeth that you have. To keep your own teeth, it's much better to do that. It's less expensive, it's less traumatic for you. It's just a better dental experience if you don't have to get go through the process of replacing missing teeth. So that's how your gut health, and that's how your gut is associated with your teeth. They're at opposite ends of our bodies, and they are there to help our bodies. And then they are good indications of what your all of your oral of your overall oral health. Both of
Mhm.
them are good indications of that.
Yeah, I think it goes back to what you talked about like the body being a complete whole system. And so
Yeah,
your mouth and your gut are both part of your digestive system. So they're even more connected in that way. So yeah, if your digestion isn't good and your gut isn't healthy, then it makes sense that your teeth wouldn't be healthy either.
very much so. Very much so.
Okay.
Yeah.
And then one more question is I hear people talk about how too much acid on the teeth is bad. And as a result, I've heard of people like avoiding certain acidic foods, but they're like fruits or citrus or things like that. And wanting to protect their teeth. So, do you suggest that? Are there certain fruits and vegetables you should avoid eating in order to have a healthy, have good oral health?
Mm, I don't think that there are any fruits or vegetables that I would say avoid eating, because most of the times, as you probably know, fruits and vegetables are pretty good for you. They're able to help our bodies a great deal. Something that does come to mind is that sometimes people like to certain fruits, but I guess not like a fruit, but like limes and lemons, those acidic type fruits. If you do too much of those are they're acidic, and they can cause a breakdown of your teeth.
Mm,
So yeah, your teeth are the hardest substance in your body. Your teeth are like so much harder than bone. They're like, I
mm,
don't know, 5 times harder than bone. But if you're doing a lot of lemons, and if you don't dilute the lemon juice that you take, if you do like if it's very acidic, lemons and limes, then you can cause some issues. That can cause some issues with your teeth. So what I would say is that lemons and limes are not bad for you, but you have to know how it is that you use them, and to use them in moderation. So you would have to dilute them where you still get the effect of it. And then you maybe might want to, if they are going to be at a high concentration, you might want to rinse your mouth afterwards. You might want to brush your teeth afterwards that you use them. But there's still, lemons and limes are not bad for you in
mhm,
as of themselves. So I don't have any of them that I would say that might not be too great for you. Of course, like the garlic with the breath thing, but I still wouldn't say garlic is bad for you. Also, you could get around that also, because garlic can be very, very good for you, right?
Hmm.
So, but usually with fruits and vegetables and those sorts of natural things, I would say, I would say that no. And let me put a caveat on that also. I would say that if you're able to do non-GMO, or you're able to do just organic, or if you're able to do, farm raised organic, that, or better yet, that you grow it yourself,
Mm.
those things are better than to go and get, like, you think you're being healthy, and all this stuff that you're eating has a lot of pesticides on it,
Hmm.
and it has like a lot of, it's grown just like not in a very good way. Then I would say you'd have to be careful, where is it that you get your fruits and vegetables from, is another aspect of that.
I think that's an interesting point too, because like you said, if there's inflammation in your mouth, that's probably an indication there's inflammation going on somewhere else in your body.
Mhm.
Um, and so I guess to expand on that, like if you're experiencing, yeah, like inflammation in other parts of your body can ultimately impact your mouth. So
Yeah,
it doesn't have to start in the mouth and spread to the other parts of your body. It can also start in other parts of your body and also
yeah.
impact your mouth as a result.
Yeah, yeah. So that's an interesting concept that you bring up, because then that kind of like makes it like a loop, right?
Mhm,
And you might not be so sure where it started, but the loop is moving, and you need to make an intervention somewhere along that loop. So whether you do that intervention in your mouth, which might be easier, whether you do that intervention in your rest of your body, it depends on what the issue is. So then that's where the holistic dentistry comes in, that we look at the whole body, right? So if you have something that's happening if there's a loop going on, there's something that's happening in the rest of the body. Most of the times I can't handle that. I'm not qualified to
mhm,
handle that. I'm qualified to handle what's happening in your mouth. But at the same time, we have resources where we can send you, where that
mm,
that practitioner has the same mindset as we do, and has the same mindset obviously as you do, that they want something alternative, something holistic, that they're able to those symptoms, and then we're able to stop that loop from happening, and then put you on a track to good overall health, not just good oral health, but to good overall health, which is really what we're aiming for.
yeah, and I think that that is kind of a rare approach to like medical intervention. Unfortunately, like that's not the typical or the norm. And like we mentioned earlier in your bio, you were the one of the first practices to come to the East Coast with holistic and biological dentistry. So has that started to expand? Have you noticed it becoming more popular, or is it still pretty
Yeah,
rare?
yeah. It's rare, but it's like it's moving along. It's moving along. There's an organization that I belong to called the IAOMT, and they do with dentistry, and some other practitioners, not just dentists, belong to the organization. Initially, there was, just like a few people would come to the meetings, and to their annual meetings. But now I go to these meetings, and the room is full. People from
Mm,
all over the country. Sometimes they have they video it, and they have it people from all over the world. So it's something that's definitely moving. That's definitely moving in a direction. And I think people want stuff to be fixed without them getting more sick. I think that is growing, and I think it's just going to grow even more, as people start to see that you can get like some real results with alternative therapies. You can get some real results by changing your diet. You can get some real results by going plant-based. You
mhm.
can you can get some real results by doing those things. I think, and those things are um relatively easy, as opposed to some of the things that might happen if you don't do those things. When
Mhm.
you get into like some serious heart issues, you get into some serious issues with your body, where you need to correct stuff while they can still be easily corrected. It works out much better.
Yeah. And I think what's encouraging about this whole discussion is that it highlights that looking at holistic natural solutions like plant-based eating, like, you know, treating symptoms and early on, it can be simple. It doesn't have to be overly complicated. I think
Yeah.
sometimes people have a misconception that, like, to experience real transformational healing, it's going to be expensive, it's going to be extremely complicated, but like a lot of the tips that you've shared are pretty intuitive, very straightforward.
Yeah.
Even the symptoms that you're highlighting that people should be taking serious, like
Yeah.
bleeding gums, loose teeth, like it's like, oh, it's not some scary, crazy thing that, you know, people might
Yeah.
be familiar with that. And so it's like you can take simple approaches that can really, really improve the quality of your life. And they don't have to
Hmm.
be extreme or out there or like super
Yeah.
unfamiliar. It's kind of
Yeah.
intuitive and kind of getting back to the roots of what we know on a certain level.
Yeah, certainly. Yeah, because that makes sense. And the other aspect of it is too is that we are we're kind of our bodies all kind of like work the same. You know, if we're able to get something that works for somebody, like this person is like, okay, I changed my diet and I'm doing this and this and that. I'm plant-based, and then that stuff will also work for you. You know what I mean?
Yeah.
It's not like we're so different that something that works for me doesn't work for you. Sometimes
Mhm.
it just takes a little bit of effort on our parts to make a switch. You know what I
Yeah.
mean? To come to the point where you're like, okay, well, I want to make a change. I'm not happy with things that are going now. Let me change my diet. Let me do something different. Let me get some information and let me see what I can do with that information so that I'm able to make that my life better. I'm able to feel better. I'm able to walk 5 miles, or I'm able to do whatever it is that my goals are. Let me make a switch, because if the saying goes, if you keep doing the same thing all the time, you're going to get the same results that you're getting. You're going to get the same results all the time. So sometimes it's just a matter of making it's a matter of making the switch here, that you
Mhm.
can do it, and then just going about doing it because people have done it before, and it can be done. You know.
Absolutely.
Yeah.
Well, so your practice of holistic dentistry is about treating the whole patient and recognizing the interconnected symptoms, but it also goes beyond like physical bodies to look at sustainable wellness and sustainable practices.
Hmm.
And so your office is a pioneer in eco-friendly dentistry using non-toxic materials and mercury-free practices. In
Hmm.
what ways, if any, do these sustainable choices like BPA-free resins contribute not just to the health of the planet, but also broader long-term health for your patients?
Oh, yeah, excellent question. Oh, yeah. So when I was opening my practice, my own practice, I wanted to do, because I was doing this holistic stuff. I was doing all of this alternative treatments and that kind of stuff. I wanted the building itself to reflect that, because I'm going to spend a lot of time in this building. My patients are coming to this building to see me. I wanted that building to be like a healthy environment for my patients. And then so we went about designing this building, and we went about doing all of these different things that to make that building sustainable, because that was important to me. I mean, you you can't talk about, well, I couldn't talk about treating patients in a healthy way and then you bring them into the space and the space is toxic. You know what I
Mhm.
mean? Or the space makes them sick or whatever. So I got a lot of pushback from some people, but like, why do you want to do that? Just open a dental office. But I think it was a good thing to do, because the space itself is a healthy environment. I think people can feel the difference when they come into the space. So the building itself, we have been awarded one of the most sustainable buildings in all of Washington, D.C. So
Mm.
we won that award for the building, and it was great to be able to do that. But that makes that's another part of what it is that we do in order to make things more healthy for our patients, in order
Mm.
for you to put you on the road that you're doing something in a different way. Also, it might be something that even opens somebody's eyes as to what is it that they can and they can't do. Or you might think that you might not be able to do that, but yeah, you can do it, because we did it. You can do something
Mhm.
that's sustainable. You can do something that's alternative. You can do something that's holistic. So I think in doing that, I think it has been a real benefit for us, to come into our space, and then to be able to spend time in the space, and then to let people know, and people let people know, and when they know, they're like, oh wow, you put a lot of effort into this, you put a lot of time into doing that. And it's like, yeah, because we want to have like the whole picture, you know.
Absolutely. Well, I mean, you've shared so much wonderful information with us today. And so, how can potential patients come see you? Where are you
Sure.
located? Please let us know everything so that folks who are in your area can take advantage of your practice.
Oh, sure. So we're the DC dentist, and we're in Washington, D.C. Our address is 509 11th Street Southeast, Washington, D.C., in Capitol Hill by Eastern Market. You can reach us at thedcdentist.com. Our telephone number is 202-544-3626. Once again, 202-544-3626. And we are the DC dentists. And that's what we do.
Thank you so, so much for being with us today for this conversation that I know was really informative. I learned a lot, and I think our audience is going to learn a lot from it. So, yeah, thank you so much for being with us today.
You're welcome. Thank you so much for having me. I appreciate it.
Thank
Yeah.
you. You're so welcome.